Welcome to Renal System Mastery, covering anatomy, physiology, and nursing management of the renal system. This video is designed to help you master core concepts for your nursing exams. Our session outline includes a review of anatomy, physiology, assessment, key disorders like AKI and CKD, and nursing management, focusing on dialysis care. We will also tackle 8 previous year exam questions. The urinary system consists of the kidneys, which filter blood and produce urine, the ureters, which transport urine, the bladder, which stores urine, and the urethra, which transports urine out of the body. The kidneys are located retroperitoneally, with the right kidney slightly lower. Key anatomical parts include the outer cortex, the inner medulla containing pyramids, and the renal pelvis, which connects to the ureter. The nephron is the functional unit of the kidney, with about 1 million per kidney. It consists of 2 parts, the renal corpuscle for filtration and the renal tubule for reabsorption and secretion. The renal corpuscle includes the glomerulus, a capillary tuft, and Bowman's capsule, which collects the filtrate. High filtration pressure is generated by the wide afferent and narrow efferent arterioles. The renal tubules handle processing. The PCT is the site of major reabsorption. The loop of Henle concentrates urine. The DCT is where fine-tuning occurs, and the collecting duct makes final water adjustments via ADH. Step 1 is glomerular filtration, a passive process driven by hydrostatic pressure. Water and small solutes are filtered, but blood cells and large proteins like albumin are not. Protein in urine is abnormal. Step 2 is tubular reabsorption, moving needed substances like glucose and water back into the blood. Step 3 is tubular secretion, moving unwanted substances like hydrogen and potassium ions into the filtrate. Quick check. 100% of glucose is normally reabsorbed in the proximal convoluted tubule. Glucose appears in the urine, known as glycosuria, only if the blood glucose exceeds the renal threshold of 180 mg per deciliter. The glomerular filtration rate, or GFR, is the total amount of filtrate formed per minute. The normal value is 125 milliliters per minute. GFR is considered the best indicator of kidney function and is regulated by arteriolar constriction and dilation. PYQ Spotlight number 1 asks, the functional unit of the kidney is the A neuron, B nephron, C alveoli, or D glomerulus? The correct answer is B, nephron. The nephron is the microscopic unit responsible for urine formation, whereas the glomerulus is only one component of the nephron. The RAAS pathway is triggered by low blood pressure or low sodium. This leads to the release of renin, forming angiotensin II, which causes vasoconstriction and triggers aldosterone, ultimately increasing blood pressure and sodium retention. Hormonal control involves aldosterone from the adrenal cortex, which reabsorbs sodium. ADH from the posterior pituitary reabsorbs water. ANP from the heart atrial cells excretes sodium, thereby lowering blood pressure. Other crucial kidney functions include erythropoiesis through the production of EPO, the conversion of vitamin D to its active form, and acid-base balance by regulating bicarbonate and hydrogen ion excretion. PYQ Spotlight number 2. Which hormone is responsible for the reabsorption of water in the collecting ducts? A. Aldosterone, B. Renin, circa ADH, or D. Angiotensin? The correct answer is C. ADH. ADH, or vasopressin, increases the collecting duct's permeability to water. A lack of ADH leads to diabetes insipidus. The ureters transport urine via peristalsis to the urinary bladder, a muscular storage reservoir. The bladder has a capacity of 700 to 800 milliliters, with the urge to void occurring at 200 to 400 milliliters. Comparing male and female urethras, the female urethra is shorter, increasing the risk of UTIs. The male urethra is longer and has a dual function for urine and semen, with prostate enlargement potentially affecting flow. Renal assessment involves a thorough history, including symptoms like dysuria and hematuria. Physical assessment includes monitoring urine output, checking for CVA tenderness, and observing for periorbital or pedal edema. Key renal function tests include blood urea nitrogen, or BUN, serum creatinine, which is the best indicator of function, and specific gravity, which measures concentration ability. A KUB X-ray is used to detect stones. PYQ Spotlight number 3. Which of the following is the most reliable indicator of renal function? A. BUN, B. Serum creatinine, C. Urinalysis, or D. Uric acid? The correct answer is B. Serum creatinine. Creatinine is the gold standard marker because its excretion is not significantly influenced by diet or hydration, unlike BUN. Acute kidney injury, or AKI, is a sudden and reversible loss of kidney function. It can be pre-renal due to hypoperfusion, intrarenal due to tissue damage, or postrenal due to obstruction. Chronic kidney disease, or CKD, is an irreversible loss of function, often caused by diabetes and hypertension. Symptoms, known as uremia, include nausea, pruritus, and hyperkalemia. End-stage renal disease requires dialysis or transplant. PYQ Spotlight number 4. Which electrolyte imbalance is a priority concern in renal failure? A. Hypokalemia, B. Hypernatremia, C. Hyperkalemia, or D. Hypocalcemia? The correct answer is C. Hyperkalemia. Since kidneys excrete potassium, failure causes high potassium levels, which can lead to life-threatening cardiac arrhythmias. This is the immediate priority. This chart compares nephrotic and nephritic syndromes, highlighting differences in features such as protein or blood presence in urine, edema severity, and primary underlying causes. Renal calculi, or kidney stones, are most commonly calcium oxalate. Symptoms include severe flank pain, known as renal colic, and blood in the urine. Management includes high fluid intake, straining urine, and lithotripsy. PYQ Spotlight number 5. Which dietary restriction is advised for a patient with calcium oxalate stones? A. Milk and dairy, B. Spinach and tomatoes, C. Meat and fish, or D. Rice and bread? The correct answer is B. Spinach and tomatoes. These foods are high in oxalates. Restricting high oxalate foods helps prevent stone formation. Urinary tract infections are most commonly caused by E. coli. Lower UTIs cause urgency and burning. Upper UTIs, or pyelonephritis, cause fever and flank pain. A key nursing alert is that confusion is often the first sign in the elderly. For nursing care plans, addressing fluid volume excess is crucial in renal failure patients, often involving fluid and sodium restriction and monitoring input and output. Hemodialysis uses an artificial kidney to filter waste. For AV fistula care, always feel for the thrill and hear the bruit. Never take blood pressure, start IVs, or draw blood from the access arm. PYQ Spotlight number 6. To assess the patency of an AV fistula, the nurse should A. Check capillary refill, B. Palpate for a thrill and auscultate for a bruit, C. Measure blood pressure in that arm, or D. Observe for edema? The correct answer is B. Palpating for the thrill and auscultating for the bruit indicates proper blood flow and a patent fistula. Absence of these suggests clotting. Peritoneal dialysis uses the patient's peritoneal membrane as a filter. Dialysate is infused, allowed a dwell time, and then drained. The major complication is peritonitis, signaled by cloudy outflow or effluent. In case study 1, a CKD patient with hyperkalemia, presenting with peaked T waves, requires priority management to stabilize the heart with calcium gluconate, shift potassium using insulin and dextrose, and excrete potassium with kiexalate. In case study 2, following a renal biopsy, the priority is monitoring for bleeding. The action required is positioning the patient supine with a back roll over the biopsy site for compression and closely monitoring vital signs for shock. PYQ Spotlight number 7 asks, the hormone erythropoietin is secreted by A. Liver, B. Bone marrow, C. Kidney, or D. Spleen? The correct answer is C. Kidney. The kidneys produce erythropoietin in response to hypoxia. This hormone stimulates the bone marrow to produce red blood cells. Renal failure patients often require epoetin injections. PYQ Spotlight number 8 asks, the urinary bladder is lined by which type of epithelium? A. Squamous, B. Columnar, C. Transitional, or D. Cuboidal? The correct answer is C. Transitional epithelium, also called urothelium. This specialized lining allows the bladder to stretch and expand as it fills with urine without tearing the tissue. Remember key functions using the mnemonic A wet bed: acid base, water balance, electrolytes, toxin removal, blood pressure, erythropoietin, and vitamin D activation. Hyperkalemia treatment is recalled with CBIGK.